Idaho Matters is brought to you in part by St. Luke's Pharmacy, now offering free home delivery. For daily medications or one-time prescriptions, home delivery is easy to set up. It's convenient and safe. St. Luke's Pharmacy, now delivering to your doorstep. Information on how to get started at stlukesonline.org.
Love Boise State Public Radio podcasts? They are free to enjoy, but not free to produce. If you can give, your support helps keep shows like Idaho Matters and Scandalize available to everyone. Donate now at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudet. You're listening to Idaho Matters. Another Ebola outbreak is growing in Central Africa, and this time it involves a rare strain that doesn't have an approved vaccine or a targeted treatment. The World Health Organization has now declared it a global health emergency, with cases spreading in Congo and Uganda. And as health officials try to contain it, there are also some bigger questions about whether global health systems are weaker right now, especially after major USAID cuts and the Trump administration's move to pull the United States out of the World Health Organization. It is Wednesday, time for our Dr. Roundtable, and Dr. David Pate is joining us today. He is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. He's here to talk to us more about all of this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. Okay, so Dr. Pate, according to Reuters, recent reporting says there are now more than 500 suspected cases that are under investigation, and there have been deaths, and those deaths are continuing to rise, as I said, both in Congo and Uganda. And World Health Organization officials are warning that this actual number of infections may be a lot higher than what has been confirmed so far. So can we just start with the beginning? Can you remind us what Ebola is and then this particular strain?
Yes, so Ebola is a virus, and it is a virus that is feared because it can cause a hemorrhagic fever, and depending on the strain, it can have mortality rates of upwards of 80%. This virus is something that typically we see outbreaks of in Africa. It is transmitted to humans through a fruit bat or through animals. When this occurs, it typically causes outbreaks because it can be transmitted through any of the body fluids, particularly vomitus or blood or semen. This is a disease that even when the person dies, those people handling the body become at risk, and the virus can still be transmitted to them. So this is a serious virus. It has made its way to the United States through a traveler in the past and showed up in a Dallas area hospital and infected a couple of health workers. And that is one of the risks of this virus, is it also infects those that care for these patients. There are 6 different strains. 4 of them are known to cause human infections. And the strain that we're dealing with right now, the Bundibugyo, this is a rare one. We've only had 3 outbreaks of this particular strain, that first being in 2007 to 2008, and then another one in, I believe it was 2012, and then now. And because this is rare and a different strain, it may not show up on our usual testing. And in fact, we think that is part of what happened with this outbreak kind of getting out of control, is that people suspected Ebola, but they were testing for the wrong one. So the bad news is that this one appears to be growing very fast in its spread and over large distances. The good news is that this virus typically has a lower fatality rate than the more common strains, and typically, although this is still extremely high, the fatality rate typically ranges from about 25 to 40%.
Okay, so Dr. Pate, how concerned should we be right now about this Ebola outbreak as it is, as far as we know, still in Central Africa?
Yes. So I do think we need to be concerned, not panicked, but concerned. And I think the reasons that we need to be concerned is, first of all, this outbreak is already very large and it is still growing significantly. So that's one reason. Second is it has now been detected in the capital city of the Congo, which is about 620 miles from where the outbreak is thought to have originated. And it's now crossed a border, as you mentioned, into Uganda. So, unfortunately, the area where this has occurred is an area that is in conflict, having military conflict. It is also an area of mining where people come to work from large distances away. And I haven't seen any reports yet, but in the past, we know that also with these mining communities in Africa, there can be a significant sex worker activity, and that those people also tend to come from distances away for the opportunity. So, and certainly the African CDC already issued a public health emergency of continental security because they realized this has the potential to spread in Africa. And while we Americans might think, well, if it's in another continent, and especially Africa, we don't need to worry. We are already evacuating 7 Americans from that area, and one is known to be infected. It's an American doctor on a mission trip there. So we have to realize that we live in a different world, and we are one cruise ship or one plane ride away from these outbreaks. And then, of course, as you mentioned, Gemma, on top of all of that, we have pretty much systematically been dismantling all of our public health strength that we've had in the past, expertise, and tools.
So, can we talk a little bit more about that? Because I'm curious to know, in your opinion, how much international cooperation matters during outbreaks like this. Because, USAID was basically gutted, right? So, could those reductions impact outbreak response capacity in places like Central Africa?
Well, there's no question that it does. So, people may not understand just exactly what all of these different programs and outreaches do. First of all, it is funding of vaccines, because without that funding and without funding from the world, and a large part of that has been the United States, then people in these disadvantaged countries don't get access to the vaccines. And while we don't have a vaccine for this particular disease, when the people are not getting vaccinated, with the common available vaccines, we see all kinds of disease outbreaks. So that's a risk. Second, many of these countries don't have the medical equipment, the testing equipment, the protective equipment for those that are caring for people, and they don't have the expertise available to them. And our United States CDC has always worked with the African CDC to help partner with expertise, equipment, supplies, testing, medicines, all those kinds of things, which are in short supply. And if they don't have that kind of equipment and supplies, first of all, there's delays in recognizing an outbreak because it's very difficult. They may have to travel many, many miles in difficult terrain to get to some place where a test can be done. And second, when they don't have the personal protective equipment, and I have seen a number of photos from the area of this outbreak, and I just am appalled that people don't have the proper protective equipment on, we're going to see more transmission of this virus. And again, it's just a matter of time before these people land in other countries. And like I said, we have had that happen to the United States in the past, so we are not immune from that.
So, Dr. Pate, let's talk a little bit also about the fact that the Trump administration also moved to pull the United States out of the World Health Organization. How could that decision have consequences on this outbreak?
So, if you look at the relationship with World Health Organization, what the World Health Organization does is it has people spread throughout the world. It is monitoring for new disease outbreaks. And in fact, the director of the World Health Organization declared this a public health emergency of international concern over the weekend for the first time without going to the emergency committee because of the urgency of this matter. So they have authority to act very quickly. And what that does is it triggers a whole bunch of things. First of all, the influx of medical supplies, testing, treatments, expertise, experts in this area that know how to contain these outbreaks. And they are a source of information for the rest of the world. And they can be communicating about where the spread is occurring, what precautions various countries need to take. And when we, as the United States, being one of the major players in the World Health Organization, when we withdraw, the World Health Organization has less resources and we get cut out of the loop. And so it just makes the world a much more dangerous place for everyone.
So, Dr. Pate, I think a lot of people are wondering, are we going to see another pandemic, right? My question to you is, are we less prepared globally for outbreaks today than we were a few years ago? Or have we improved since COVID?
No, I think we are clearly and objectively less prepared. First of all, I've checked with somebody in a position to know to see if they know something that's not publicly available, and I did not get any kind of assurance that I'm mistaken. But it is my belief that the national strategic stockpiles have not been replenished since COVID, which means if listeners think back to how things were in 2020, many of you may remember the images of in the papers, like I saw, of nurses covered in garbage bags for protective gowns because they didn't have access to it. And I think our supply chains have probably gotten worse. We are now having supply issues already because of the tariffs, because of the Strait of Hormuz, and also because of various military conflicts. And of course, the latest talk with the president's trip to China is China going to take action against Taiwan, which could draw us into military conflict, and realize that China is one of the major suppliers of many things that we need in healthcare here, because we don't have the capacity or capability to make those things. So we have supply chain issues. We have, I was talking to a doctor just last night who is here in Idaho and telling me, given the traumatic experience the COVID pandemic was, that when the next pandemic hits here, he's just going to retire, even though he's not ready to retire. Mm-hmm. And the impression that there's a lot of physicians that just are not going to go through another one of these. And so we could be in real trouble. In that case, we already have a physician shortage. And then, of course, we have our state legislature that has taken away most of our tools. They have made it outlawed that we could not have mRNA vaccines, which is probably the only technology for a vaccine. If we could come up with a vaccine against whatever the threat was, it would be an mRNA vaccine, but Idahoans would not be able to access it. And of course, they've stripped our public health agencies of many of the tools that they have to contain outbreaks. So I don't think there's any question that we are much less prepared today. And we thought we were prepared back in 2020. In fact, we were rated by those that rate countries for their preparedness as the top country. It turned out that we had middle of the pack performance. We were not the best prepared back then either. And I think it's only gotten worse.
We've talked about this rare hantavirus outbreak that was tied to a cruise ship, and it is being monitored now across multiple countries. Now we have health officials in Colorado who are investigating an unrelated hantavirus death. This appears to be the first known hantavirus outbreak linked to a cruise ship, though. Can we talk about how unusual that is before we talk about the Colorado case?
Yes, so we have had hantavirus here in the United States, but as you say, not common. Most of the cases do occur in the western part of the United States, and Colorado is one of the top 4 states for getting cases of it. But to your point, in the last roughly 30 years, we've had just shy of 900 cases. So it's not huge, but it is a disease that is very capable of killing people. The disease that we get here in the United States is called the hantavirus pulmonary syndrome. And so what happens is people get fever and muscle aches and fatigue. And then within a week later, they start getting shortness of breath, chest tightness, and basically their lungs fill with fluid. And oftentimes those people will not survive. This is a completely different strain than what is affecting the cruise ship. That was the Andes virus from Argentina. The virus we get here of the hantavirus is called the sin nombre strain. But we have cases every year, and this is transmitted through the excrements of rodents, saliva, urine, feces. And so what typically happens is we see cases where people are perhaps cleaning out something maybe out in the yard that's not frequently used, has a lot of dirt, dust, and so forth, might be rodent infested, and they start sweeping or whatever, and that aerosolizes the virus. They breathe it in, and then they get this infection.
So, Dr. Pate, for folks who are here in Idaho, because we have had hantavirus cases in Idaho, it's been years, but we have had them. What are the main ways for people to protect themselves? Because I'm thinking back to a case that, in fact, I covered probably more than 2 decades ago in Valley County, where a man was sweeping out his cabin for getting it. I believe they were getting it ready for the summer, and so they came in. It had been closed up for the winter, and it was that he inhaled dust basically from rodent feces. What should people be doing in particular this time of year if you are in a situation that is similar to that?
Yeah, I think the first thing is be on the lookout for droppings that would suggest that there might be rodent infestation. Second, if you find that, or even if you don't find it, a really good idea is to just have a pest service do, round the year treatments, particularly if it's a place that you're going to leave abandoned for a while because you're coming back to Boise and then you're going to go there at another time of the year. That would be a good idea. But if you are just going to go and clean it out, the first thing to do is to put on a N95 mask. And then second, what I would do is spray down the area with a disinfectant or with diluted Clorox bleach, and get it wet, because when you do that, when you spray it, then the virus is much less likely to be aerosolized. And given that you're wearing an N95 mask, now you're much reduced chance of breathing it in. And then, of course, try not to, do something where you're really stirring this up. Like with just, a vigorous sweeping where it's all going to kind of raise up in the dust. If there is a way to ventilate the space before doing it, if there are windows or doors that can be opened, do that, that kind of thing.
So, Dr. Pate, I've got about 3 or so minutes left with you, and I really want to talk about traveling because we are heading into summer. People are getting set to travel. I mean, cruises, international travel, and we've seen this hantavirus outbreak on this cruise ship. We now have this Ebola outbreak, in Central Africa that we talked about in the last segment. What should travelers be doing right now as they're getting set to travel? And how concerned should folks be?
So, not highly concerned, but you want to be, sensible, and you certainly don't want to have your special vacation disrupted by people getting ill. So, the first thing is, if you're planning a vacation, particularly international travel, the first thing to do is check the CDC website for travel advisories. Check that country's U.S. embassy for warnings. And so just be aware, are there particular disease outbreaks in the place that you're going to be going to? Another option is to go to a travel medicine clinic where those are people that stay up on all these different events happening around the world and get a recommendation from them if you are adequately vaccinated, or if there are some vaccines that you normally wouldn't get here in the United States that might be advisable for going there. And some of those vaccines can require a significant amount of advanced time to give the vaccine and perhaps a booster. So as soon as you're thinking about where you're going, you might check in on what are the vaccination suggestions for that particular country. If you are traveling with a very young child that's too young to receive the normal vaccines, talk to your pediatrician, because there are concerns more so than any of the infections we've talked about, but things like polio, measles. So check with your doctor, but careful planning ahead will reduce your chances. And then scope out and figure out, if you were to get sick wherever you're going, what hospital would you go to? How would you get help? What do you need? Do you have a medical evacuation plan? That kind of thing.
And some of us, when that happens, call you, as happened to me 2 years ago in Europe. So I appreciate that, Dr. Pate. But in all seriousness, really, Really good information for everyone to know before they travel. I want to thank you so much for joining us today. We've been talking to Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. You've been listening to the Idaho Matters podcast from Boise State Public Radio. To stay in touch, you can find quick Idaho daily news every morning when you subscribe to the Connector podcast. Just by listening, you're helping to support public radio right here in Idaho. And I want to say a big thank you for that.
You know, every day on Up First, NPR's Golden Globe-nominated morning news podcast, we bring you 3 essential stories. At the heart of each story are questions. What really happened? What really mattered? What happens next? At NPR, we stand for your right to be curious and to follow the facts. Follow Up First wherever you get your podcasts and start your day knowing what matters and why.